All right, let's talk about pharmacology. So, first one we're going to talk about here is antiparasitics. So, these are going to eliminate parasites, whether they are internal, which is found inside the body, or external, which can be found outside the body. So, when we're talking about different types of drugs that we can use that are antiparasitic, not all drugs kill all the things. So, there are some drugs that kill certain worms or insects, things like that. And so, you have to make sure, depending on what type of critter you have, that you're using the right drug to kill them. So, our nematodes up here, these are going to be our roundworms. Cestodes are going to be tapeworms. Trematodes are going to be flukes, and then protozoans are going to be single-celled organisms. Protozoans are not a worm. These three up here are worms. They types of medication can come in different application types. So topical is very commonly used. If you use like an over-the-counter flea medication and you give a couple drops on the back of the neck, that's topical. Systemic are going to be any type of medication that the animal ingests in order to kill the parasites from the inside out. A lot of these medications also include an insecticide, so that's why there's a lot of controversy of using anti-parasitic medication because people don't want to give their animals insecticides. Also, we have to be careful with this when we're giving it to like food production animals because then that's going possibly into our food supply. So just be aware of that. A lot of our medications may be adulticidal or preventative. So this means that this is only either going to kill the adults or it's going to be a preventative, like prevent like reproductive stages of that parasite from in order to get to adulthood. So these are going to treat endo and ectoparasites. Not all medication treats both. So endectocides are going to treat both internal and ectoparasites. So some other terms that you should know when we're talking about antiparasitics. Antihelmintic means eliminates helminth parasites. So these are going to be our dewormers. Bots, there are some, if you've ever seen bot flies before, these are the larva stage of a fly. So look up on YouTube bot fly removal. It is probably one of the most disgusting things you've ever seen. Those of you who like those pimple popper movies, this one's for you. Cestodes are going to be tapeworms or segmented flatworms. They are a different class than like our roundworms, and we'll talk about those. Microfilaria are pre-larval stage of filarial worms transmitted by biting insects. We talk about this with heartworm. So what this means is that they are microscopic and they're itty bitty tiny little baby worms before they become into a giant big adult ones. Nematodes are parasitic worms that are round when looked at a cross section. This includes strongyles, hookworms, ascarids, whipworms, and roundworms. So these guys are long like spaghetti. The cestode looks like sesame seeds or rice. So cestode, sesame seed, nematodes are your roundworms. Trematodes are going to be called flukes, and they are non-segmented flatworms. Protozoa, again, are single-celled organisms, which are Coccidia, Giardia, or Toxoplasma gondii. Again, a lot of these we'll talk about in the lab class, so which is VTA 130. This is just a brief introduction into that. Marcolides, so this is a drug class of antiparasitic. Avermectins and milbemycins, these are the types that are under that. These are what are called broad spectrum insecticides. So if you remember, that means it kills both internal and external parasites. Flukes and tapes are not affected. Flukes and tapes like to do their own thing because they are a little bit more tougher to kill. And so these broad spectrum guys aren't going to kill them. Milbemycin oxamine and ivermectin and selamectin are going to be the 3 different types of drugs we're going to talk about here. These are all heartworm preventatives as well, and they are microfilaricidal. So these are going to kill those little microfilaria guys, so the little baby worms. Depending on the formulation, maybe a daily, monthly, or every 6-month dose, depending on the type of drug it is. So milbamycin, if we come down here, oxime is sentinel. Ivermectin is the active ingredient in Heartgard, and selamectin is the active ingredient in Revolution, which we'll talk about those here in a second. These guys are highly recommended to assay parasite load before treatment. And this means check our parasite load before treatment, because with heartworm, if we administer a heartworm preventative while they have heartworm, we can actually send those animals into anaphylactic shock with the worms dying and it's shocking their system. So we always run a heartworm test prior to giving any type of heartworm medication. We can use ivermectin and selamectin, Revolution Heartgard, usually, not ivermectin, ivermectin straight up, not the Heartgard brand. Without doing a heartworm test, we'll use a lot of ivermectin in cattle. In Revolution, we use much commonly in, very commonly in cats. So those guys don't necessarily get heartworm tested like dogs would. If they're going on Heartgard specifically or Sentinel specifically, then they need to have a heartworm test prior to receiving that medication. Imiticide, this is definitely another one of those that you want to make sure that you're checking heartworm load beforehand. Collies, no matter what kind of collie it is, border collie, bearded collie, smooth coat collie, rough coat collies, or collie mixes can be very sensitive. They have what's called the MDR1 gene. This MDR1 gene that these dogs can carry can cause neurological death when given these ivermectin based products. And so there are tests that we can run beforehand on these critters to make sure that they don't have it before we start breeding them. But again, sometimes with our mixed breeds, we have to be very careful before we give it to them. So here's our heartworm life cycle. So the larvae migrate. Let's start back here. So the larvae enter a new host when the animal is bitten by an infected mosquito. Heartworm, when we talk about vectors, so heartworm has to go through the mosquito and then bite its host in order to be transmitted. So the larvae migrate to the animal's heart and develop into adult worms. Adult worms then reproduce in the heart, and microfilaria may be found in the blood. Here, those are our microfilaria guys. And then the mosquito bites the infected animal and ingests the blood containing the microfilaria. And then in 10 to 28 days, the microfilaria developed into the mosquito larva within the mosquito, and then the life cycle continues again. So pretty detrimental disease here. We can see animals die from it if we're not careful. And so it is a pretty lengthy process to treat these guys that do have adult heartworms. It is easier to kill the microfilaria, but it's pretty expensive to treat these guys. We're talking like several month process to kill them, because if we kill the worms and the parasites off too quickly, then they have risk of going into anaphylactic shock. So this is a really interesting graphic here. So this was from the American Heartworm Society in 2013. So the severity of heartworm incidence as shown in the map is based on some average number of cases per reporting clinic. Some of these areas don't have as many offices, therefore they have no reported cases from those areas. So this is 2013, so this is 7 years ago. They come out with it like about every 6 years, and so I'm not sure if the 2019 one is out yet. And so if we look up here, go back. If we look down here, we can see this is what we again call those hotbed states. And so they have 100 plus cases per clinic. And so it is hot down in the south, and this is where all them critters and those mosquitoes are hanging out. If we look up over here in Washington, where we are, yeah, maybe have 1 to 5 cases. If we look at, thank you, global warming, 6 years, 7 years now in advance, now we're in 2019, this has actually grown a lot more. Um, the reason being behind that is that I've talked about this before. In Washington State, we do not have the number of animals that people would like to have up here, so we can't meet the supply and demand of pet owners. And so we are bringing animals from all these hotbed states down here that are, that have overcrowded shelters, overcrowded rescues, things like that. And so in these heartworm epidemic areas, now we're trucking all these animals up into areas like, say, Washington, or up here, that places that don't have heartworm normally. And so we are now seeing a lot more heartworm up in these areas. Yes, we still get a little cold enough that mosquitoes do die out, but it is not getting extremely cold enough that we need to really kill off everything and to help reduce that population. So this, as years keep going on, this is going to get worse and worse. I mean, this looks really bad in 2013. Like, I can't wait to see the 2019 graphic, because this is going to be like even worse over here on heartworm cases. Again, we see a lot of people in Washington, they're like, oh, I'm never gonna, we are in Washington, we don't need to do heartworm protection. You'll be surprised, it's getting a lot worse up here. Here's just some examples of the products that we talked about. Sentinel, Spectrum, HeartGuard, Sentinel. These two Sentinel products are very similar. One does like a little bit extra deworming process to it. Revolution's going to be one of your probably most common drugs to use, just because it's so safe for cats, and we use it a lot for dogs as well. Some other Marcolides, if you're familiar with them: Interceptor, Advantage Multi, Sentinel Spectrum, TriHeart Plus, Iverheart Plus, Trifexis, ProHeart 6. ProHeart 6 is the only injectable heartworm preventative available in a 6-month treatment. So you only have to dose these critters twice a year. It also does treat and prevent hookworms. It was pulled off the market about 10 years ago due to potential causing patient deaths, probably because they were cats. They realized due to inappropriate administration, so now they have to go through special trainings to use this. We don't use this very often, especially in Washington, maybe down in like those hotbed states like Texas, Florida, Georgia, things like that. They are probably going to use this a lot more. So when we are administering medications, these antiparasitics to our patients, this is a really big point to look at down here, is that you're using the appropriate size of medication for your species. If other sizes and other species products could result in anaphylaxis or severe adverse reactions. I'm going to post a link to a video of a cat having anaphylaxis shock due to it was given dog flea medication. And there are some flea medications that can be given to cats that are extremely toxic. People will give it off label because they think, they're like, oh, well, I'm buying flea meds for the dog, I'm going to just treat the cat as well. There's a reason why they are species specific, because they can cause these severe anaphylactic reactions. And so you have to be very careful of that. Benzimidazole. Oh, you're going to try that again. Benzimidazoles. There we go. Thiabendazole treats ascarids and strongyles, so these are going to be roundworms. Fenbendazole is probably one of your big ones that you got to know about on this one, which is also called Panicure. This treats roundworms, hookworms, whipworms, the Taena species of tapeworms, pinworms, Paragnomyces, strongyles, strongyloides, and protozoa. So this is like a really nice one-shot kill everything. The big thing with Panicure is that it is expensive. You can see it either in a powder form, and you give like a packet of the powder every day to the patients. I think it's for like 3 days or 5 days, or you can do a liquid. They're both pretty expensive because if we look here, it's killing a lot of different things. Albendazole is used in livestock and may have a teatrogenic effect. So what this means is having potential to cause birth defects. It is really effective against nematodes, cestodes, trematodes, and protozoa. So we have to be very careful with our livestock if they are in a gestation, like if they're carrying young, that we have to be careful not to maybe use this dewormer on them so we don't cause any birth defects. So here's our life cycle of our worms here. So adult worms are laid in the small intestine, eggs are passed in the feces. Another way that egg larvae and eggs can get passed is through transmitted route to the offspring, and so they will actually secrete through the mammary glands into the puppy. Very disgusting. And then the mom, as she's cleaning up all the puppies' poop and, licking them clean and stuff, she just keeps reinfecting themselves. So it's this lovely vicious cycle of worms. Or say they didn't have puppies, again, eggs passed in feces, eggs, embryonate, and embryonate eggs in feces are then ingested by an intermediate host. So this is that middleman. Usually it's like some sort of little rodent or some sort. And then the intermediate host either like gets in contact with the fecal matter or eats the intermediate host, and then the cycle begins anew. So it's a big to-do. And so that's why people, when they have worms, like say in their house or in their yards, things like that, it's really, really important to make sure that we like eliminate those intermediate hosts, clean up stool samples, things like that. Otherwise, these animals are just going to continue to reinfect themselves. So here's Panicure. Here's the liquid. Ooh, too far. Here's our powder here. These are the nice little fancy packets. Sometimes it's in a giant like tub, and then you have to dispense the granules depending on your clinic. Usually the tub's cheaper. These are more expensive. Albendazole right there. Usually we'll give them liquid doses of that. Other antihelmintics, pyrantopamoate's a really important one. Treats ascarids and hookworms. Very safe. Strongid, pleasant tasting liquid. I don't know if it's really that pleasant tasting. I've gotten it in my mouth before. It's this like banana yellow. It's also known as Nemex. It's supposed to be vanilla or banana flavored. I think it tastes like crap, so it doesn't taste that good. Puppies and kittens love it. They'll lick it right out of the syringe. Piperazine is ascarids only. This is an over-the-counter once-a-month dewormer only. Organophosphates developed as nerve gas. Yeah, we don't use nerve gas anymore to kill parasites, just because obvious reasons. The other two really important things, two important wormers that you should know, Praziquantel, which is Dronset. These kill tapeworms and it allows the host to digest the tape. So it just literally kills the tapeworm and then they digest it. Same thing with the Esperantal or the Cestex. This is also going to kill the tapeworm as well. These are probably our main two that are going to kill our tapeworms. They're coming out with new products all the time, so these are but these are our go-to for those. Here's our tapeworm here. The fun thing is that when we see the tapeworm is that the head is actually enlarged into the digestive tract, feeding off the host. What you see coming out in the stool sample are actually these little things called perglottids. And so these are little egg sacs. Yes, you're like, wait a minute, I've seen them move before. Yep, they do their own thing. It is disgusting. So the perglottids shed eggs on the ground. Flea larvae eat the eggs. Tapeworm larvae incest in the flea and become ineffective, and so they just hang out there. Fleas are eaten to cause infection. So what we can suspect that if an animal has fleas, they have a very good chance of having tapeworms, or vice versa. If we see or we're like, oh yeah, that animal has fleas in its stool, they most likely have had fleas at some point or have fleas currently. So you have to treat both in order to get rid of one or the other. So here's our Drontal, Dronset, and our Cestex there. All right, so antiprotozoals. So these are going to be our single-celled organisms. Some of these should look a little familiar from before, probably in our other PowerPoints that we've talked about. Sulfonamide antimicrobials, sulfanodoxine, sulfadimethoxine, there we go, which is Albon. That's going to kill the coccidia, okay? And then there's metronidazole, also known as Flagyl. These don't make any sense. They have no correlation at all, like remembrance-wise whatsoever. That's going to kill Giardia. Benzimidazole antiemetics, fenbendazole and albendazole. Again, those are going to kill coccidia. Furazidine, furazidine, think also kills Giardia, if I remember that. No, I think it does kill coccidia. Panazaril, we see this very commonly used, which is also called Marquis, treats EPM and used in shelters. So EPM is equine protozoal myeloencephalitis caused by protozoal infection in the central nervous system of horses. This we use a ton in shelter medicine. We use it for coccidiosis all the time. It's this big, thick white paste that we dilute down, and because it's meant for horses essentially, and so we dilute it down and give it to like puppies and stuff like that. So if you look at here, fecal oral, wash your hands, don't let your dog lick you in the face. This is how stuff spreads. Cysts and trophocytes. So trophocyte is our non-infective stage of Giardia. The cystic stage is going to be the more infective stage of Giardia in our patients that we see. So here's some examples of that. Okay, external antiparasitics, pyrethrins and pyrethroids. These are going to be derived from the chrysanthemum flower. Very poisonous to fish. I don't know why fish need external parasitic control, but I'm not a fish expert. Permethrins are not to be used in cats. So this is the one that I was talking about. If we see it as a dog medication and it's given to a cat, can cause anaphylactic shock and death in our cats. It's really, really dangerous. Marcolides, milbemycin, selamectin. We can treat ear mites, sarcoptic mange, and fleas. Ear mites are going to be found in the ears. Sarcoptic mange is a zoonotic mange that burrows beneath the skin, causes severe itching and aggravation to the skin of the patient. Fleas, pretty straightforward on fleas. Imidacloprid, there we go. Say that. It's an insect neurotoxin, also known as the active ingredient in Advantage. This is a topical once-a-month flea adulticide, so this is going to kill all adult fleas. Fipronil, insect neurotoxin. Fipronil is going to be the active ingredient in Frontline. Top Spot, those are also topicals. Capstar, nitinpyram. So this is a tablet that rapidly kills adults and can be used daily. So it kills adults, starting almost immediately. I think it takes like 5-10 minutes to actually work. And it lasts for about 24 hours. It's an adulticide. The biggest thing with Capstar, you can buy it over the counter, but it is not a long-term flea medication. We've seen animals kind of have some liver issues after that, after it's been given multiple times. So we have to be careful of that. Lufeneron, which is Program. This is an insect development inhibitor, so it interferes with the development of chitin, larvae, and eggs affected. So these are like the larvae, this is like the baby flea, things like that. Lufeneron injection for cats, we like to use this because it lasts 6 months. It doesn't kill the adult fleas, but it kills the reproductive system, so that way, they can't reproduce and make more babies. Really, really great for cats that are outside all the time. So like feral cat colonies, things like that, bring them in every 6 months, give them the injection, and they're good to go. Because these guys we can see a lot of worm loads and flea infestations on those critters. Midaban or Amitraz, topical for treatment of mange mites, need well-ventilated area, let dry. We can see some upper respiratory issues being caused by this. I've never used Midaban. I've heard about it. We also have used Revolution before for sarcoptic mange as well. Ooh. So here's a life cycle of the flea. Fleas that we also call them practice builders because fleas are really hard to get rid of. They live in the environment for a hot minute for sure. And it is definitely, once you have them, it's hard to get rid of them. And so these guys, the eggs are laid on the pet, 25 to 40 eggs per day. Eggs fall in the environment, hatch in 2 to 5 days. So our larvae get bigger and bigger and bigger, pupas. The adults take several blood meals a day, and so that's what's going to cause the itching. We can see animals that have such severe reactions to the saliva of the fleas, and so they have like severe allergic reactions to that. So really, really important to keep flea medication on your pet all year round, just because thanks global warming, it is not getting cold enough. Even in Washington, we're like, we just had snow. It's still not cold enough to kill all the fleas off. Once it's cold outside, guess where everything goes? Everything goes inside where it's nice and warm. So all the fleas just migrate inside onto our pets. So it's pretty disgusting. So here's some examples of frontline Capstar program. Some other ectoparasite preventatives that we're seeing on the market. It's changing on like a monthly basis. I mean, everything, there's all these new stuff and things like that, and stuff are getting taken off because they're like, oh, this isn't effective anymore. Comfortis, Parastar, Parastar Plus, Frontline Tritac, Hearts, Bravecto, Vectra, Vectra 3D, uh, Certifect, Preventic collars. Terrestrial collars are really cool. They're supposed to last like I think 3 months, and they don't have like the residue on there like old flea collars used to. Activil Plus, Excalibur. Knockout is an area spray that kills external parasites in the environment, which is nice. NexGard and Brevecto are really nice products because they are like a chew. Um, I think they're beef flavored treats. Brevecto lasts for 3 months, and NexGard lasts for 1 month, and they are flea preventatives. They don't unfortunately kill internal parasites, but they're really, really nice. Easy. The biggest thing is compliance when it comes to flea medication, or topical excuse me, external parasite medication, because we want to make it as easy for our clients as possible. And then here are also some examples of that. You can get a lot of our flea medication is not over the counter. The ones that we're seeing like stuff reports in like news and stuff like that are over the counter medications that we can see them being misused like on cats and things like that. A lot of our flea medications are prescription required. So just be aware of that. Okay. Right. Thank you.